ideas and offer some options for the president to seriously consider, rather than not reading the bill, signing it into healthcare because he has an inflated sense of urgency. I appreciate you all being here. We're expressing our freedom of speech today before it may be curtailed in every arena. Let me give you the Dash health care reform package. Because Medicare gets a waiver and we all pay the cost of Medicare, let's have the government pay 60 cents on the dollar where they pay 25 cents now. That's going to put a lot of cash into the healthcare system. Healthcare is local. We have a bountiful number of good healthcare organizations in our region. Let's keep them viable so we have choices on where we can go.
That's right.
That will help the healthcare systems. Now, because they're getting an influx of capital, let's make them responsible for taking care of the healthcare needs. So we know in our community what the unemployed folks are going through. We know through our charity care, through our no-pay care, which is rising. Let us be responsible for our home communities, because still the first reason for picking hospitals is location, location, and location.
That's right.
We got into this business to help people. Let us help in our home communities. We know better than Washington. If we're going to get that healthcare influx of cash to 60% being paid by Medicare instead of the 25% that they're paying now, let's restrict hospitals so you can only make so much. We'll negotiate with you, Mr. President, on what that percentage looks like. It's not going to be 20%. It'll be in the 5% area. Restrict hospitals to that percentage. If they go over that percentage, have hospitals pay that money into the state coffers for the Medicaid population, thus increasing access again.
Makes sense.
Our physician colleagues have taken a hard rap. But when you have to pay $100,000 out of your pocket for health insurance because of the tort reform that we have in this country, it's really not fair that the rap that doctors are getting. So, but let's help them out of the economic pressure and provide incentives for them align in a salaried position with hospitals around the country, so they're not incentivized to take surgery. People do surgery with me not needed. Now that is that much of a percent. But because that rap is out there, let's take the doctors, align them with the hospitals. We have a common mission and a common population to serve. Let healthcare workers live out their personal passion mission of why we got into this business.
Yeah.
I believe in the transparency of healthcare, and I want to maintain the reporting relationships that we have in the industry so that you have a better idea on what doctors and hospitals that you should go to. I'm all for that, and let's set high standards that healthcare organizations have to complete. Those hospitals that are exceeding those profit percentages will have a 3-year period of time to adjust their percentages down to what we would negotiate with the federal government as an acceptable profit to continue with the quality care that we're giving. Let's regulate the insurance companies.
Yes.
Yeah.
And when we regulate them, let's take out the non-patient friendly aspects of their insurance coverage, like pre-existing conditions.
Yes.
Cause hospitals to reduce their profit to be in line with the national standards. Phase this program in over a 3-year period and evaluate it against the goals and objectives of quality and access. Ladies and gentlemen, taking an active role in our society as you're doing today humbles me and makes me feel like I should do more of this. So I appreciate you being out here. I appreciate the young Republicans taking the initiative to have this happen today. Mr. Obama, your popularity is dropping. Washington knows nothing about health care. Look at what they've done in Medicare. Look at what they've done in Medicaid.
How about VA?
And VA also. I've been in the VA system and doing hospital consultations, and I'm not proud of the VA healthcare system. And and I also have an honorable discharge, sir. So what it was nip and tuck on the honorable part. We shouldn't ask the people that broke this system to fix it.
That's right.
That's a good
I have a
point.
privilege of working with people that call themselves healthcare workers. They have a passion, a personal passion. They get into this business. They could be doing more lucrative jobs, but they get in this to help people. What this is going to do is constrain our ability to be able to reach out to our home communities, because we will not have the dollars to give you quality health care. And what's going to happen is hospitals go out of business across the country. Obama's main objective of increasing access will be reduced as those hospitals go out of business. And you will not be able to get into a local facility on a timely basis.
Nope.
So wait for a year while we give you an MRI to make sure that it is cancer that you do have. I'm not looking forward to that. That violates my personal mission. Thank you for asking me to be here. God bless you.